Good evening. Welcome to BW Wellbeing of BW Business World on the Mind, Bodies and Soul show. Today we have a very special guest with us, Dr. Samir Parikh. Dr. Samir Parikh is a consultant psychiatrist, director, departmental of mental health and behavioral sciences, chairperson Fortis National Mental Health Council, Fortis National Mental Health Program, Fortis Healthcare. Good evening, sir, and welcome.
Pleasure.
So, so how have the last 100 days gone for you, and what's keeping you so busy?
No, I think it's been unprecedented for almost everybody. I think anybody and everybody in the world has uh, had a tough last 100 days because we were not prepared for it. So, like anybody else, whether it is working from home, whether it is working a lot more digitally, I think that has been the key aspect. Being a mental health practitioner, so I've been doing a lot of online consults um, so that my patients continue to get their treatments. Have done a lot of webinars with school, the corporate sector, a lot of social media engagements to create awareness and positivity. So that's the kind of work that I have been doing. It's a busy 100 day that has been.
So, when did you first get your inner calling and embark on this path?
I'm not too sure inner callings and all actually is the best way to look at most careers. I think life just takes us to where, Gurley keeps on giving options. 12th wanted to do medicine, so took the usual bio combo, got through medical entrance, went to Civil Ahmedabad, did my MBBS there, did my internship at Bara Hindu in Delhi. Um, During that period, felt intrigued by psychiatry, went back to Ahmedabad, did my MD and DPM in psychiatry, found psychiatry something quite meaningful, um, felt that, this is what I always should have done and wanted to do. And once I joined in 97, since then it's been psychiatry. So I think that's the best way to look at it. Not sure if it's an
Okay.
inner conflict or not, but I do feel that even if you'll give me my 25 years, I will end up taking my branch all over again.
Okay, sir. Sir, what motivates you to help others?
See, like I said, that we need to appreciate that every work that any individual does in any branch, there are multiple reasons behind it. Whether we are a healthcare practitioners or like you in media, there are all reasons that we have, right?
Yes, sir.
Sure, it's only about helping and healing. I think it's about doing something that you think is worthwhile, doing something that makes you feel that you are doing something worthwhile. I think that's the way to look at it. Um, Dealing with people, helping people come over their troubles, their difficulties, helping them cope with their struggles, and helping them treat with medical illnesses, because at the end of the day, mental ailments are medical illnesses, and to create awareness about it, it is these things that drive me.
Okay, sir. So, could you please give me a little insight about your books? You've written quite a few books, sir.
So,
Like,
I've,
where did the ideas come from? When did you, which was your first book, and what were you thinking when you wrote it down?
so we've written a few books. Most of it came from the work that we do. We have one of the most established school mental health programs that works throughout the country. So, Let Him Not Sink was a book that Kamna Chibber and myself wrote. It was essentially a manual that we thought of for people who work with adolescents, and we thought that they should have an insight, which was Rupa publication. We wrote two books which were do-it-yourself life skills book for children and adolescents. These were Macmillan publications, written with my colleagues Aditi Kaul, Mimansa Singh, Divya Jain, Kamna Chibber, and myself. Then we ended up writing a comic, which was It is a Laugh and Learn, again, a Rupa publication. Rupa has been um, our publishers. We have very, very good relationship with them. They're very supportive of the work that we do. So we came up with the comic Laugh and Learn, which is about the first volume was on study and exam skills. So Addy and Anaika were these two characters. So Laugh and Learn with Dr. Parikh, the first volume was on study skills. The next volume will come very soon. So the idea was to use comic to help children learn. Again, that book was written with the help of colleagues. Again, Kamna Chibber, Divya Jain, Mimamsa Singh, also Alina Ali and Tanushi Sangma, besides my own self. We wrote the mental health curriculum, which was printed by Macmillan. Macmillan. So the curriculum essentially is training teachers on how to have conversations around mental health. So that curriculum was written with, again, with colleagues, Nilya Dutt, Divya Jain, Mimamsa Singh, Kamna Chibber and myself. So that was for schools, and the curriculum we've been taking across to various schools. Then with Mimamsa Singh and Kamna Chibber, I wrote a book called Raising Confident Children, a 52-week guide, which is more a parenting book that we wrote. And then during these last 100 days with COVID, we came up with 2 e-readers, essentially nudged and guided by Kapish Mehra from Rupa Publications, who said that we must come out with something. So one e-reader was on how to engage with your children during a lockdown, which was a parenting book written by again Mimamsa, Kamna and myself. And then the other one was how to keep your mind fit during a pandemic. Don't worry. Again, a Rupa Publication e-reader, which was written by Nishta Narula, Divya Jain, Kamna Chibber, Mimamsa Singh, and myself. So these are some of the books that we've been writing. The focus essentially being on preventive mental health, on positive life skills. A lot of it is on school mental health.
Okay, sir. Sir, what do you feel the younger generation needs to do or think in these times of fear and anxiety?
I think they should be connected with their friends, which is very important. I think they should keep a very good routine in their life so that normalcy of the life is not compromised much. If they struggle or are worrying, they should talk to their family, friends, colleagues, teachers. I think they should use this time to connect with their cousins and their grandparents and their extended family, and also pick up this time to learn more things, learn new stuff. I also feel young people need to be very, very responsible in the use of social media and use social media positively and do not allow it to be a negative influence on their lives.
Okay, sir. Sir, what would you like to say to people who are very scared, anxious, and uncertain about COVID-19?
I think they need to accept the fact that all of us have the uncertainty, which is the same. You and I both are equally uncertain about how life will be in the next few months. Nobody has an answer to that question worldwide. We have to accept that reality. The fact is there is an illness, and the fact is there is an uncertainty. Let's accept it. Now we should focus on what can we do about it. Follow medical guidelines, follow government advisories, be responsible, be careful, and continue with your productivity. Stay connected with people, spread positivity, be positive, be collective, and we'll come out of this.
Okay, that's fantastic, sir. Sir, many people from the younger generation have moved to addictions of alcohol, smoking, even drugs. What would you feel is the way to address these issues?
I feel very, very sad when I see um, any person who is addicted to a substance, more so when that person is a young person. I just feel that collectively as a society, we are failing young people, that we aren't able to give them enough knowledge, life skills, enough guidance, enough role models to ensure that they don't use substances. To me, substance use is all about prevention. I think we need to work very closely with the school population, uh, empower them with knowledge and life skills so that they do not get into substances. I think we need to discourage the use of experimentation, recreational drugs, experimentation just for friends, just under peer pressure. Oh, it's only sometime. Oh, it's moderate. Oh, this is less safe, that's less safe. All this is rubbish. We should not even allow these to enter our mindset. We need to talk about prevention, saying no every time. And it's important that we take initiative in school years on substance abuse, because if we can work in that age group, we'll be actually able to make a substantial impact.
Okay, so you've achieved a lot, yet you're very humble. How do you inculcate this humility?
I don't think I've achieved a lot. I don't think anybody in that way achieved. We all do what we have to do. I think intrinsic motivation is what matters. You continue doing what you like, doing what you believe in, your values, and you continue moving forward. You'll have ups and downs, you'll have questions, and you'll have um, comments, and you'll have judgments, and you'll have difficult times. You just continue to move forward, right? That's one thing. I don't see the whole way. I mean, achievement is not reward, it's not recognition, it's not followers, it's not views, it's not awards. All those things are peripheral to our movement in life. You just continue doing what you do, and that's the only way to do it. And you need to treat every day as important as the earlier day. You celebrate anything that you are able to where you know that you've had a good day, you celebrate that. But you continue to move forward. There is no other way, because the moment you allow uh, the perception, the external perception of how one does to get into you, you stop being yourself. You continue to be who you are. And if I give it a more personal connotation, frankly, I whatever one has been able to do, it's because of teachings of our teachers. So my super ego and my ego ideal has been Dr. Bharat Panchal, who taught me everything that I know in psychiatry. In fact, sir, I think just retired last month from after a long, unbelievably long, brilliant building up lives of people like me.
So, do you think people right now are in the biggest need of psychotherapy?
I don't think psychotherapy and what is happening right now, I'll put them separately. Right now, people are in need of social support from all levels for each other because of the stress that we are all going through, which does not mean everybody needs to go to an expert. What it means is that we need to value each other, we need to value well being and mental wellness. And what we can do at individual level is talk it out, don't bottle it up, and be good, have good support systems. Now, having said that, if an individual is struggling, then yes, reach out to an expert. And I think that's the way to look at it. Psychotherapy or psychiatry medications, in any case, have a role for mental ailments. And if one is going through that, COVID or no COVID, you go seek help, because help is available, help is effective, and help is going to bring you out of the illness like any other illness. It could be a typhoid or a diabetes. Depression, for example, is an illness. So that's how you look at it.
Okay, so the lockdown has affected everyone. Do you feel that people are introspecting more? Or what about extroverts? What is keeping them sane?
Two different aspects. I don't look at life in terms of extrovertism or introvertism. I think
Okay,
we all have traits. They're all unique individuals who really can't be categorized into two big categories. There'll
yes.
be different people have relating to it and handling it differently. Those whose support systems are well connected and bring positivity in each other deal with it better. Those who are not able to do that, they don't deal with it better. Those where support system will encourage you to stay at home, don't take risks, you'll be like that. But those where support system will say we must go out, we should do this, we should take a risk, it doesn't matter, then you will be more prone to doing that. And I think that's how one needs to look at it. And to me, the essence of coping is staying connected, staying positive, staying productive. You look at these three components and you'll be able to deal with it. If you continue to be productive, including the home, related work that you do, taking care of your own house, that's also being productive. You may be working from home, you may be having a flexible routine. Whatever best productivity you can do, you should do that. You need to stay positive and keep people positive around you and stay connected. These three are the pillars around which our fight of COVID would happen.
Okay, so the pandemic has changed people in a lot of ways. Could you please elaborate on this, like how people's perspectives have changed, how?
To be honest, it's difficult to say that have people changed, will people change, has that change already happened? But I think if we introspect, we would be able to bring some positive change in ourselves. We've learned a lot of things. We've learned minimalistic living. We've learned that we can take care of our own house. We've learned that we needed people always. And now, when we are connecting with more and more people, you may be now more connected with your alumni, your extended cousins. You've always needed them, but you never had the time for them. Now you are reconnecting with them. I think we should have learned a lot of humility, that a virus is an equalizer, does not see who and who's not, and a virus is an equalizer. And I think we should end up learning collectivism, because if the pandemic has taught us anything, it's that individuals don't count. At the end of the day, it is social responsibility, social collectivism, altruism, empathy. Look at the way healthcare workers are working. It's unbelievable. The way the medical staff, the nursing fraternity goes through hospitals, continues to work, exposes themselves and their families. It's a remarkably inspiring aspect. And look at so many people who've done different things for various kinds of people who needed help. So there's a lot of positivity there if we are willing to look at it and then learn it. I think that's the way to look at it.
Okay, so could you tell us about two instances where you've changed people's lives, or two people's or three people's lives for the positive, without names, of course, and like what exactly did you do to change them for the better?
So I don't think this changing life in terms of the clinical work is that really fits in. I don't see it like that. I see that if you had diabetes and you went to a doctor and he treated you and your diabetes went fine, you may have come to me for an anxiety or a depressive illness and I helped you. So I wouldn't like to see it in a different way. If I look back, then I think some of the work that we've done, for example, our helpline, which is a 24-hour helpline, which is run by psychologists in 15 Indian languages. We take over a few 150, sometimes 200 calls a day. And I think that brings a lot of meaning, because we know that we are helping people in crisis. It's been a helpline running now for several years. I think when I look back at it and see how hardworking our team is to be able to do that, I think that's very positive. I think the work that we've been able to do in schools, and Fortis School Mental Health Program, which reaches over 300 cities in the country, is a program which has no cost to it. We don't charge anything at all for the work in schools. And the lives that have been touched is remarkable in terms of the response. So whether it is, we've made peer role models, we've created anti-bullying squads, we've created so many different people, young people taking responsibilities, including on the quiz that we do every year, which is Psyched, where you have young people waiting to be a part of a psychology quiz, bringing interest into psychology, a branch which was largely stigmatized and neglected, is able to be talked about. So I think that's something there. And third, I would say, is the work that we do with in advocacy. We run a young mental health advocacy program every year. We've worked a lot in social media to create awareness on mental health, all through young people. We are at best guides, role models, if at all you want to call us that. But the fact is, it's their energy, their creativity, their compassion, and we've been able to find a way to channelize it. And I think that difference, that impact, that reach, broadly, I'll say these three things. When I look back, I think that's a good job done.
Okay, so people with other mental disorders are finding the lockdown unbearable as they can't even move around freely anymore. Maybe people with ADHD, PTSD, OCD. You would know everything about that, sir. What can be done for such people who are just stuck and are getting depressed now and can't move out?
See, let's understand there will always be a more vulnerable population whenever an illness like this happens, which affects everybody. The vulnerability may be because of age, it can be because of circumstances, it can be because of other illnesses, medical or otherwise.
Okay, sir.
That illness, medical illness, I mean, there will be vulnerability. What you need to do is the family needs to ensure that we give them better care, we give them more space, we ensure that their treatment and their support services are maintained as much as we can. We keep our antennas always sensitive, that if there is something happening, then we can talk to their respective expert and get them the help. I think that's how one should look at any vulnerable population.
Yes.
It would be different for somebody, let's say, having any other medical illness vis-a-vis a psychiatric illness.
Okay, so. So people's perspective about life, money, mental health, solitude has changed a lot. What would you like to say to that, sir?
I hope it continues to be that. I hope we will hibernate again once we are out of this. I hope we are collectively able to learn a lot more. I think that's the key here. Right now, we are in a learning phase, evolving phase. Every other day, there is something happening, a change is happening. So we are obviously adapting, trying to adapt, trying to respond to it. Once it's all over, I just hope we don't go back to our earlier living style. I hope we still, like I said, some of the things that COVID has taught us, I hope we imbibe them for a long-term future.
Okay, sir. Sir, what are your hobbies on a personal note?
My hobby is I listen to music,
Okay.
mainly classical.
Okay.
That's my favorite. I sometimes also listen to some Western classical. And sometimes Sufi, maybe sometimes even some ghazals or old film songs. But essentially, it's a Hindustani classical. I read a lot. So reading is something which always interests me. And then whatever little time I get, it'll be for spending some time with plants. So these three things is where my hobbies are.
Okay, sir. Sir, what are the measures you are taking during this situation, like for yourself?
It's just been so sudden and unprecedented. To be honest, haven't got much time to react. Immediately shifting into teleconsultation, so it took a bit of time to adapt to it. Then the amount of webinars that we took with the corporate sector, we reached out to over 1,100 schools since lockdown. We've done so many lives and engagements through media, social media. So, to be honest, I have no idea how the last 100 days have gone. It's just been a non-stop roller coaster ride. And the one thing that one has been very careful with is I've followed all the medical advisories very, very strictly. I don't think personal discretion has any role when it comes to following guidelines. Besides that, like I said, it's been hectic. It's been different, hectic, but we've reached collectively as a team a lot of lives, and that's the little contribution that we could have made. It's a drop of water in the ocean, but it's a drop. Indeed,
Okay. Sir, could you tell us about the little about the work in the corporate sector? About your work in the corporate sector, sir.
Done is we've done a lot of workshops around work from home and how to adjust to it. We've done now we're doing how to adjust to the new normal of living with COVID and what are the impact. We've done a bit of parenting. We've done with school teachers on stress, coping and teaching. We've done with sports associations. We've done a lot of art-related work, which is how do you imbibe arts in your life and learn to go to de-stress and have some positive life skills. So those are the kind of engagements that we've had with the working population.
Okay, so we've got a little time left, so we can. I just want to know, what would your closing statement be? What message would you give to your viewers and our viewers?
To all adults, it's time to be role models for young people. I think the last decade and a half, we have failed to be the right role models for the younger generation. From negative narratives to our language, to our behavior, to our aggression, to our values or the lack of them, to our not valuing what matters enough. There's lots that we've not been able to do. I think we need to introspect and become better role models. From COVID's point of view, I think COVID has been a huge teaching moment if mankind is able to understand it, because ideally this should be a life-altering experience for everybody. None of us had ever thought something like this could happen. It is happening. It has happened. It's the greatest equalizer that we will ever see in our lifetime. And if it should have brought us down from our flying modes into a more grounded humility. And if we can understand the importance of relationships, invest in them. Importance of minimalistic living, importance of taking self-care and caring for people whom you care for, and frankly, altruism. At the end of the day, compassion, generosity, altruism, values, this is what makes a civilization what it is. And we need to accept it, that we were losing our path. So if COVID ends up helping us redefine ourselves, and mankind version 2.0 post-COVID is a better version of itself, then we would have done justice to the future generations.
Thank you so much, sir. Thank you so much for your time. We are very, very grateful to have you on your show.